to tell our viewers about the effects of COVID-19 or its vaccines are not the reasons behind the sudden rise in deaths among young adults. An ICMR study has revealed the same. Now, the study is based on data collected from 729 cases where people aged between 18 and 45 without any comorbidities suddenly died. Now, as per the medical research body, hospitalization before COVID, family history and lifestyle behaviors are the primary reason behind this phenomenon. Now, other causes behind the sudden increase in young deaths include drinking 48 hours before death, using drugs and substances, or performing physical activities 48 hours prior to death. All right, so that's the latest that we can tell you as far as what this study does state. In fact, the key takeaways being that it's not COVID or the vaccines that are causing these young deaths that we are seeing. The study details reasons in terms of what's really killing India's youth. What we're picking up as far as this data has revealed is that smoking and drinking is one of the reasons, and of course, clearly raises questions or rather puts the spotlight on the lifestyle that is followed. As far as the study is concerned, it was based on data collected from 729 cases. If you're talking about the age group, it is between 18 and 45. To also stress upon the fact that when this data was collected, it was done on those people without any comorbidities suddenly died. Now, what we also do understand is that as per the medical research body, hospitalization before COVID, family history and lifestyle behaviors are the primary reason behind this phenomenon, which we are seeing of a sudden rise in death among young adults. So the same has been studied by the medical body, that is ICMR, which has now revealed the effects of COVID-19 or its vaccines are not the reason behind the sudden rise in deaths among young adults that we have been witnessing in multiple episodes. What we also are given to understand as far as causes behind the sudden increase in young deaths, as per this data that has been collected, is that it includes drinking 48 hours before death, using drugs and substances, or performing physical activities. Akanksha, my colleague, joins me over the phone lines. Akanksha, very good afternoon. As far as we speak about the ICMR study revealing these key takeaways, just to help our viewers also understand, it's also putting a spotlight on lifestyle per se.
Well, absolutely. As you rightly mentioned, ICMR conducted this investigation after individuals aged between 18 to 45 with no underlying health issues. They died suddenly from unexplained causes between October 1st, 2021 and March 31st, 2023. And the concern that was raised in various reports were also published, and the reports were drawing correlation between the COVID-19 vaccine and these sudden deaths. After that, this study was conducted, and now it has been found out by ICMR that in fact COVID vaccination did not increase the risk of sudden death. It actually reduced the risk, and the death could be because of the COVID hospitalization, family history of sudden death, binge alcohol drinking, intense activity. So these could be the reason for the sudden death. So clearly ICMR has made it and has clarified that there is no correlation between the COVID infection or vaccination and the sudden deaths which were reported, as I mentioned, between 2021 and 2023, that in various reports were attributed to COVID-19 infection and the vaccination.
Right, Akanksha, I appreciate you getting us all the latest details and also drawing things into perspective as to what the data actually reveals. But for the moment, we leave the conversation at that. We're shifting our focus